Because what you heard then about the opaqueness, let's say, of this funding system, this is why people get worried about a private health system, as we heard then. It isn't really entirely that, because you feel like ill people are vulnerable people, and ill people can therefore have advantage taken of them. And when somebody who is an expert in that system can't even tell you how much it costs to go to a GP, that's when the likes of Bob and me realise that it could potentially descend into being an absolute racket.
Look, I completely agree. I'm not an advocate of the American healthcare system. In fact, even most American healthcare analysts, from whatever their persuasion, that was a libertarian think tank, Cato, that we just heard from in the US. They're not a particular fan of the American healthcare system. It is a fundamentally broken system in so many complex ways. And that's why I think it's, quite frankly, it's interesting to hear more of the details. I think we get a very basic version of it in the UK media, that there's just some not really how it works in practice. But I don't think it's a useful starting point when considering debates about the NHS or making comparisons to other countries.
But we feel like we're going that way.
Well, I just don't think... I know that there's a political claim that the UK is going that way, but I don't think that's true. I just don't think it seems likely whatsoever that politically you could, even if you wanted to introduce an American system. The American system has its own history, its own context. The UK system has its own history, its own context. The UK has universal healthcare, which has extremely strong support. It's something that I fully support. I think we should absolutely have healthcare for everyone and ensure the government supports and make sure that happens. So I don't think the American system, which is traditionally more individualist, although with heavy levels of government intervention and subsidy, is a particularly interesting comparison point to the UK.
Go on, Bob. I know I can hear your brain whirring silently beside me.
Just to pick up on the last thing you said, both the IEA and the Cato Institute do not advocate universal health care. So let's put that on the table. What we heard about the American system, well, the UK system is now designed to flip into a Medicare system, which is state-funded, but privately operated and privately provided. NHS hospitals are now being set up as hospital chains. These will become available for private equity firms and large banks and financial institutions to own the hospitals. We have a system of administration and bureaucracy which resembles the managed care system, all of which Matthew doesn't recognise. What we heard about the discussion about charges, well, you have to bring in a totally separate bureaucracy. Once you start charging, who sets the charge, who collects the bill, who does the billing, who does the administration? The reason the NHS worked so well, as the Veterans Association in the US worked so well, is the overhead was 4%. 4%. Now, the US overhead, management and shareholder dividend and chief executive pay, 36% is taken out of the system just to run the system. So we are copying the most expensive, the most wasteful, the most bureaucratic system. All this nudging us into, wasted GP appointment times, that's nonsense too. If a patient of mine doesn't turn up, I don't sit there twiddling my thumbs. I've got results to look at, I've got letters to look at, there's plenty of work. So I'm afraid that's a tactic of nudging people to resent each other's health needs.
I can see that, to resent each other's health needs, but also to just surrender to the idea that it's broken and we're going to have to start paying to it. And then the nudge towards just £10, just £10, just £10.
Exactly.
And suddenly the gate is open for us all paying for it.
Look, anything is theoretically possible. You can make any claim you like about the future, but it doesn't mean that it's true or likely or realistic. For example, we heard a claim there, banks are going to start owning NHS hospitals. Now, that is just like, there's just not something that's on the cards. It's not legally possible. Now, yes, there can be private funding in financing of hospitals, and there had been in the past, and the Blair government made mistakes when it came to certain partnerships. But I just want to ask Bob a question. What proportion of the NHS is outsourced, is spent on private enterprises? What percentage?
There are various estimates.
No.
There's some ranging from about 10% to 20%. 10% administration charge, private finance initiative. HSBC, which is a bank, owns some of the PFI contracts.
So the truth is, and this is what the King's Fund say, who are the analysts
I'm just telling you, I'm proving to you, what you've just claimed as a fact is wrong. HSBC, a bank, owns private finance initiative, contracts, which means they have ownership of the hospital.
No, they don't own the hospital.
So
they finance the hospital. That's like saying the bank owns your property because they have a mortgage on it.
The Institute of Economic Affairs is not an advocate of universal health care.
Well, that's not. I mean, that's not true. I'm telling you what I advocate for. You can tell me what I do or don't. But let's make this clear. So the NHS outsources, and this is what the King's Fund says, 7% of is purchasing private services. Things like community pharmacies, things like ensuring sometimes getting operations done in a private hospital if the NHS is a bit overwhelmed. Now that percentage hasn't changed. It was 7% in 2019. It's 7% in 2022. It was 7% back in 2012 when we got the Health and Social Care Act. The truth is the amount of private sector involvement in the NHS is not changing. There have been talks about this plan to privatise the NHS for decades. My colleague Kristen Nemitz has gone through the articles. You know, there's always a month to save the NHS, 6 months or 6 weeks to save the NHS.
So explain this to me, Matthew. Why did the 2012 Act in legislation allow NHS hospitals to earn 49% of their income from private patients? Why did they do that in legislation?
Did they do that?
Yes, they did.
They earned 49%.
49% potential from private patients.
Did that happen?
It's happening. Why do it otherwise? Why change the law?
So what that legislation enabled is...
Now we have the Health and Social Care Act 2022, which has created these managed care style organisations which will have fixed budgets and allowed to extract profit from money they're not spending on patients through the denial of care. So you need to get up to date.
This is complete nonsense. What's happened is there's been various restructures and attempts to introduce an internal market system into the NHS, an internal market system, so that you have within not you as a patient, but you as a system uses prices in order to signal certain things and to do a cost and set a budget for an organisation. Any organisation, any bureaucratic organisation has prices. It has prices as a way to coordinate and structure things. GBNews has a price system. It pays people's salaries. It has budgets. That's all this is. We're just talking about an internal market system within the NHS.
Which costs a lot to administer.
Well, of course, but any bureaucratic system costs a lot to administer. The question is about the efficiency.
No, it
absolutely does.
Before the market reforms, I've told you the overhead was 4%.
But then we have to make a clear distinction here between the fact of there being market reforms and the NHS being privatised. These are two very different things. One is an internal, structures of the NHS, which you can talk about for days, and maybe you're completely right. Maybe the system doesn't work. I don't know. You could potentially be right. But it's something very different to saying the NHS is about to be privatised.
I'll make this point, Bev. In 2012, this internal market that Matthew talks about as a totally benign condition was made into a compulsory external market by the Act of 2012. It's in the legislation, so everything had to be tendered out, right? So you do, because it's against the public interest, because overwhelming public opinion, even Conservative voters, 70 to 80% want the NHS, they know it's politically toxic, so they have to do it by stealth, and people like Matthew have to come on the TV and say it's all about copying the Europeans.